observed my patients over the years, I discovered that, and read research, the three leading causes of death are, and disease are, cardiovascular disease, cancer, and neurodegenerative disease. And what's not on this slide, but I will mention, is the most feared illness of all, particularly of people as they age, are strokes. It's pretty much the #1 reason, or the most feared illness that an older adult can have. So I consider that part of the cardiovascular disease. What do these diseases have in common? Well, they have one thing in common: inflammation. Has anybody heard about inflammation in the audience? Okay. Pardon?
It's a joke.
It's a joke. Oh, a joke? You've all heard about inflammation? And one of the residents was telling me this morning that he was going to the dentist. And it turns out there's a lot of inflammation in your mouth that contributes to inflammation in your body. So there's acute inflammation, such as if you get a splinter in your finger, your body reacts to that. And that reaction is favorable if you want to get the splinter out and not get infected. But if the splinter festers, it causes an inflammatory reaction. All the blood cells in your bodies get revved up, and it's an undesirable reaction. And there are a lot of things that we as Americans do, that create inflammation in our body, and there are things that we can do to correct it. Now, one of the questions I might ask rhetorically is, how many of those things have you folks done or not done? How lucky you've been? Or maybe you've done things all your lives that reduce your risk for having inflammation. I'm going to show this picture of a blood vessel. I've known about this blood vessel for a long period of time, and it's still the subject of lots of scientific research, because as people age, their blood vessels become more stiff, collect fat, get inflamed, they rupture, and have a heart attack. And it doesn't happen in one day. It happens over time in terms of the inflammatory process. But that little thing that looks like a pimple that's just busted, that's an acute event, and that's an acute heart attack. So we now know that that's contributed to by cholesterol, but many other things. It's an ongoing process, and it has a lot to do with inflammation. So